Hello everyone, welcome back to the Pharma Palette. In our previous video, we learned how the electrical impulses travel through the heart. But have you ever wondered why the heart never gets tired? Why it keeps beating automatically throughout the life? And why it does not remain in one continuous contraction? The answer lies in some unique electrical properties of cardiac muscle. In today's video, we will explore the automaticity, excitability, conductivity, contractility. We will understand why the SA node is called the heart natural pacemaker, learn about the pacemaker action potentials, and see how these electrical events are reflected on an ECG. By the end of this video, you will be able to connect the cardiac electrophysiology with the ECG patterns seen in the clinical practice. So let's get started. Let's start the video with the refractory period. So what is refractory period? Once the action potentials are generated, the cardiac cell cannot be able to stimulate again immediately. So once after the action potential is generated, the cardiac cell cannot stimulate again immediately. So that is why it will be preventing the continuous contraction. It maintains the proper rhythm. This will also protect the heart from the excessive stimulation. Coming back to the functional properties of the cardiac muscle. So here there are four different properties. One is automaticity, second one is conductivity, third one is excitability, fourth one is contractility. So automaticity means you already know, we have discussed in the previous video, that it is simply the ability of the cardiac cell to generate the impulses without any external stimulation. So that is automaticity. Second one is conductivity. So conductivity means it is the ability of the cardiac tissue to transmit the electrical impulses from one cell to the another cell. And third one is excitability. Excitability is the ability to respond to the electrical signals and to produce the action potentials. And the last one is contractility, is mainly to produce the contraction. Now, how do you remember this? Simply just remember that automaticity will be generating impulses. Conductivity will be transmitting impulses. Excitability will respond to the impulses. Contractility will be finally producing the contraction. So coming back to the next part, it is the pacemaker action potential. So we already know that SA node is the pacemaker. So there are two special features for this pacemaker action potential, that is SA node. First thing is there is no true resting membrane potential. Second one is the it will be causing the spontaneous depolarization. So in this we have three different phases. One is phase 4, phase 0 and phase 3. So in the phase 4 there will be spontaneous depolarization. So what happens here? There will be slow inward movement of the sodium channel. So there will be slow inward movement of the sodium channel. Thereby it will be causing the membrane to be less negative. That means the membrane will be in the positive condition. Thereby it will be generating the next impulses automatically. And coming to the second one, that is phase 0. So phase 0 is the depolarization phase. So here there will be opening of the calcium channels, due to which the calcium will be entering into the cell. Thereby it generates the action potentials. Then coming to the third phase, which is phase 3, it is the repolarization phase. In this repolarization phase, the calcium channels will be closed. Now the potassium will be leaving out of the cell. So in this condition, the membrane will be again getting into the negative stage. So the membrane potential here becomes negative again. So just remember that there are the pacemaker cells contains only phase 4, phase 0 and phase 3. So in this pacemaker cell, the phase 1 and phase 2 will be absent. So now we will see the fast response and the slow response action potentials. So if you see the location, so the atrias, ventricles and the Purkinje fibers will be showing the fast response, and SA node and AV node will be showing the slow response. And coming back to the main ion, so in the fast response fibers, sodium is the main ion. In slow response fibers, calcium will be the main ion. So coming back to the upstroke, in the fast response fibers, it will be rapid. Coming to the conduction speed, it will be fast. And the same thing coming to the slow response fibers, the upstroke and the conduction speed will be slow. Coming back to the resting membrane potential, in the fast response fibers, it is present, and the resting membrane potential will be not stable in case of slow response fibers. So this is a small difference between the fast response versus the slow response action potential. So coming back to the next part is the ECG correlation with the cardiac conduction. So ECG will be mainly recording the electrical activity of the heart. And coming to that ECG, it is having different waves. So now let's discuss what happens in the each wave. So first one is the P wave. So in the P wave, this will be mainly representing the atrial depolarization. And second one is PR interval. In the PR interval, usually there will be conduction from the atria to the ventricles. So we can see the conduction of atria to the ventricles with the help of the AV node. That's why this PR interval will be useful for identifying the AV nodal conduction time. And third one is the QRS complex. So QRS complex means this will be representing the ventricular depolarization. And the next one is ST segment. ST segment is simply the plateau phase of ventricular action potential. So that means this ST segment, it will be representing the period where the ventricles will be remaining fully depolarized. In this ST segment, ventricles will be fully depolarized. And the last one is the T wave. In the T wave, this will be representing the ventricular repolarization. So this is simply the recovery phase of the ventricles. Back to the last part of the video, the conduction velocity. Usually there are different cardiac tissues which will be conducting impulses at different speeds. So some can be fast, some can be slow. So the fastest ones are the Purkinje fibers and the slowest ones are the AV node. And the main importance of this AV node delay is that it will be allowing the ventricles to fill with the blood before the contraction. It allows the ventricles to fill with the blood before contraction. So that's the complete electrophysiology of the heart. Let's give a quick recap. So we have explored the unique properties of cardiac muscle, understood how the SA node acts as a heart's natural pacemaker, learned why the refractory period is essential for maintaining the normal rhythm, and connected these electrical events to the ECG. So remember, every heartbeat follows a precise electrical sequence. As long as that sequence remains normal, the heart functions efficiently. But what happens when that electrical system goes wrong? What happens when the impulses are generated too fast or too slow or travel through an abnormal pathway? That's when the arrhythmias develop. In our next video, we will begin exploring the cardiac arrhythmias and understand the electrical disturbances behind the abnormal heart rhythms. If you found this video helpful, don't forget to like the video, share it with your study partner and subscribe to Pharma Palette. See you all in the next video. Thanks for watching.